Hello everyone, my name is Nuha Mohammed and I'm a summer intern at Geisinger presenting my research titled Characterizing Familial Hypercholesteremia in the NIH AllofUS Cohort. Let's begin by discussing familial hypercholesteremia, also known as FH, and how the condition affects afflicted patients. FH is a genetically inherited disorder marked by elevated levels of low-density lipoprotein cholesterol, LDL-C. FH has been shown to cause a significantly increased risk for atherosclerotic cardiovascular disease. Genetic studies suggest that FH can be divided into 5 discrete subtypes as follows. 1. A monogenic FH variant. 2. A high LDL-C polygenic score. 3. Elevated lipoprotein A. 4. Elevated LDL-C polygenic score with elevated lipoprotein A. And 5. A positive family history without an identifiable genetic cause. AllofUS, the other important part of our study, is a research cohort involving millions of participants across the U.S. This cohort allows researchers to study the interplay between biology, lifestyle, and environmental factors. Our study ultimately seeks to explore the differences in treatment, comorbidities, and cardiovascular disease outcomes between FH subtypes. To scope the utility of the AllofUS cohort for studying FH, we explore the prevalence of FH in the AllofUS cohort. We indicated familial hypercholesteremia for individuals using an LDL-C threshold of 190 milligrams per deciliter. A value greater than or equal to 190 indicated FH. If participants were exposed to statins, which are lipid-lowering drugs, we adjusted the LDL-C by dividing by 0.7 to reflect pre-statin exposed values. Figure 3 represents how the datasets were extracted and filtered from the AllofUS cohort for our study. Overall, we analyzed the 506,260 participants in the AllofUS cohort. Of these, 21.05% had a recorded LDL-C value. To determine the relationship between FH and statin treatment, we compared adjusted LDL-C values in statin-exposed to statin-unexposed individuals. On average, adjusted statin-treated values were 24 milligrams per deciliter higher than untreated values. This is consistent with the patient's use of statins for hypercholesteremia. Overall, our results confirm the potential of AllofUS as a reliable cohort for studying FH. In continuing our work, we hope to stratify the data by FH subtype and analyze it in context of risk of cardiovascular disease. Some steps are highlighted here. These steps would allow us to perform regression analyses to compare cardiovascular disease risk between FH subtypes. Thank you for listening, and I would like to acknowledge my mentors, Dr. Alexander Berry and Dr. Matthew Ogens, for their support and guidance throughout this project.